Now, many countries around the world are experiencing the second COVID-19 wave. From South Africa, Rwanda and the Democratic Republic of Congo, the numbers are high.
Yeah, so what measures are being used globally to control the second wave? Let's find out. Innovation and Sequencing Platforms Director Tulio de Oliveira joins us live via Skype to unpack this. Prof, thanks for your time. We appreciate it. So we passed this critical 1 million mark when it comes to infections, but important to note that almost 850,000 people have recovered from the virus. Put it into context for us, given our infection rate.
Okay, thank you, and good evening to all your viewers. Yeah. So just to put in context, what we are seeing in South Africa on the number of infections is probably just the tip of the iceberg. Why that? Because even that we have been recording in the last week up to 14,000 infections, South Africa is not doing a lot of testing. Yeah, our max number of tests have been 50,000 a day. And we end up going with a positivity rate of today of 32%. Yeah, this is extremely high. It's probably one of the highest positivity rate in the world, which probably means that we have many folds the number of infections. Yeah, when one talk about recover, what one have to think, one shouldn't compare with the first peak because that was a few months ago, and these people shouldn't be adding the statistics. We have to be looking at active cases. Yeah. So what we do, as you know, KwaZulu-Natal is close to 50,000 active cases. And each of them, it is causing 2 or 3 infections. So we're gonna really grow the number a lot in the next few days.
And it's not going to get any easier to deal with it, Prof, especially with that new variant that came in, really affecting people worse than we saw earlier. People are getting more sick, and it's difficult for healthcare workers to deal with those infections as they arise.
Yes, exactly. So what South Africa has described, and you may remember we, with our health minister last Friday, is this new variant, the 501 V2. Yeah. Why the V2? Because the first main variant of that mutation was found in the UK. And both of them seem to be much more transmissible. And that's why we are seeing this very, very, very fast surge in infections in the country. And we're going to have to decrease the number of infections. Otherwise, our healthcare system will get close to collapse in the next days or weeks.
So, Prof, the South African government is very focused on actually telling people to be safe, follow the protocols, etc. What about the vaccine? We're seeing it being rolled out in several countries around the world. South Africans are asking, why is government not putting that much energy into actually bringing that vaccine into South Africa? We're nowhere close.
Okay, thank you for that question. Yeah, first, both as the scientific researchers and the government, we didn't expect the second wave come so early. Normally, we don't have massive second waves in the summer. And the rollout of the vaccine had been focused a lot on the countries that were in the winter, because that's when they were expected the biggest second wave. So South Africa was expecting to roll out the vaccine beginning of next year. Yeah, but now I think that we should think serious about increasing the speed of rollout of the vaccine.
And Prof, we're also going to have to think about who's going to get the vaccine when it comes to South Africa. It's become almost a war of the vaccine. Is it the healthcare workers? Is it the country's elderly? How do we streamline the distribution of the vaccine when it finally does arrive?
Yes, of course, that the first priority should be with people that are likely to develop a disease, yeah, because this means get sick, and that normally is people of advanced age and with strong comorbidities. But more than ever, we have to really support our healthcare workers because they are really under extremely severe stress, and we have to protect them from getting infected, but also to give them the trust to help us to fight this pandemic.
Prof, one last question for me, just regarding our government's response to COVID-19. Initially, we went into the 21-day lockdown with the aim of beefing up our facilities, healthcare facilities in particular. We're now sitting at a second wave where government and authorities altogether are saying we're struggling to deal with the second wave. That might be an indication that we didn't do enough.
Yes, it is difficult, yeah. The South African health system has been affected for close to 20 years of HIV and TB epidemic, yeah, and we are neither expecting the second wave to come so quick. But I think that the crucial focus now should be to what we talk a lot in the beginning of the pandemic, try to flatten a little bit the curve. What it means doesn't mean that we may have less infections, but we have to distribute the infections over time because quite soon or as you are reporting, I saw some of your pieces before, we are completely running out of beds. So it's going to be crucial to decrease transmission, and this means try to control interaction between people, and quick to try to build more, have more available beds and oxygens and ICUs, yeah? So I think that the public health response is going to have to increase a lot in the next weeks.
Right, and then just a final one from me, Prof. Other countries around the world have entered the second wave of coronavirus, and I'm just wondering, does South Africa have the kind of resources to deal with with the resurgence as the other countries have dealt with, plus the fact that we are without a vaccine?
Okay, so first, it's a good example to look at the UK. Yeah, the UK, they also describe another variant that's highly transmissible, like our one. And they are battling, yeah. And the NHS in the UK is really under severe strain, and they have a much stronger health system than us, yeah. So we also gonna battle on this response, yeah. But what we have to do is just to use every weapon that is in the arsenal. This means better both public behavior, mask, sanitizing, and keeping social distance. I think that the government will have to think about stronger interventions to decrease both mobility and also people gathering, yeah, and also in the same time try to increase testing, contact tracing, and desperate build more hospitals and beds, yeah, and also support our healthcare workers. I cannot stress you how under severe strain they are. We work very close with the hospitals, yeah, and they are really battling. Yeah.
All right, Prof, I think your dog needs your attention. We're going to leave it right there. Appreciate your insight. Innovation and Sequencing Platforms Director Tulio de Oliveira.